Hello, Dr. Saldivar again. Today we'll be looking at Chapter 11 of Feldman's text, Essentials of Understanding Psychology. Chapter 11 is on the topic of health psychology. This is an interesting area because it's one that many students are not really aware of when they come into this general psychology class, even students who have an interest in pursuing a career in psychology. Health psychology examines how our thoughts, feelings, and behaviors as human beings affect our physical health and well being. It's kind of a cliche, but you've probably heard people say things like, well, if you feel bad or if you tell yourself that you're going to fail a test, let's say, then if you decide beforehand they're going to fail the test, it's going to be hard to do well because you've already decided that you're going to fail the test. Similarly, our health and well being, our physical state, can be affected by our emotional state, our cognitive state, our thinking, the kinds of behaviors that we engage in. So this is an area that health psychology focuses on. Health psychology explores the connection between our minds and bodies, specifically by studying things like how stress impacts our overall health, why some people are able to stick to healthy habits such as regular exercise, good diet, while other people struggle to do those things. Health psychology also looks at ways to cope with illness and medical treatments. If you ever had a loved one, a friend, someone you know undergoing a very serious and complicated medical treatment, for example, chemotherapy because they have cancer, the treatment is meant to, over the long term, save someone's life, but the treatment itself can be very, very challenging. It's physically tiring. Sometimes it can be quite painful. It's difficult to remain in a positive state of mind even if you know that this treatment, let's say for cancer, is meant to help you. If the treatment itself is very agonizing, it's tough to remain in a good mood. So health psychologists will look at ways that some individuals are able to cope with that challenge in order to try and learn and see what they're doing, how they think, how we can adapt maybe some of their tactics to other people. And then finally, questions such as how our relationships in life and the social supports we have, our support networks, family, friends, how they influence our health. These are all the kinds of questions that are looked at by health psychologists. Health psychologists use the knowledge that they gain from answering these kinds of questions to help people make better health choices, manage chronic medical conditions. A chronic medical condition just refers to something that is ongoing, something that takes years to cure or perhaps might never be cured. If you're diagnosed with diabetes, for example, you may have periods in life where you don't take medication, but you will always have diabetes. Other kinds of conditions, syndromes, heart disease, other kinds of medical conditions are going to last your whole life. So you'll need to learn how to manage that. And this is what health psychologists, among other things, look at. The goal here is to try and improve the overall quality of individuals' lives who are facing these kinds of challenges. Now, health psychologists focus on helping people develop what are called effective stress management techniques. A lot of these things that we need to do if we are managing a serious health condition, like diabetes or cancer, for example, can be stressful. And that additional stress of itself, even apart from the medical condition underlying or causing the stress itself is known from years of research to have a lot of bad outcomes and cause people even additional health challenges on top of whatever condition that is causing the stress. Health psychologists look at ways to identify and promote specific behaviors that can support the body's own natural coping mechanisms. Coping mechanisms are the stuff our body does in order to help us fight off the dangers, the challenges that are brought on by stress. From the perspective of a health psychologist, the human body's response to stress is very complex. It involves biological, psychological, and behavioral processes. So it can get quite complex. But it takes looking at these different areas to really understand and determine what can be done to help people. That's always the ultimate goal, is helping people. You have probably learned in a biology or anatomy class, or maybe you'll recall from earlier in this course when we were looking at the biological underpinnings of human behavior. One of the things that evolution has wired into us as humans is what's called the fight or flight response. When we, as humans, and by the way, all primates have the same kind of reaction, as do many other kinds of living creatures. If we perceive a threat to us in the environment or some kind of challenge to our physical well-being, to use an example, if you're walking in the woods, you're just hiking, having a good time, enjoying the scenery. You turn a corner, there's a bear standing there in the middle of the path. The bear's just standing there looking at you, hasn't done anything, but obviously none of us want to run into a large wild animal like a bear that can be dangerous. At that moment, when your body your brain realizes that you are in imminent danger, not current danger, maybe nothing's happened yet, but danger is possibly coming around, this fight or flight response kicks in. The brain tells our endocrine system that we need to prepare to either run away or fight for our lives. Adrenaline and other hormones will dump into our bloodstream. Our heart rates will elevate, our hearts will beat faster, our respiration will increase, we'll start breathing more quickly to try and get more oxygen. All these things are meant to try and energize or boost our body system so that if we have to run away, we have a lot of energy and oxygen to let us run away. If we have to fight, we have the adrenaline and the oxygen to help us physically handle the task, the rigors of having to get in a fight for our lives. This is something that happens because evolution wants to give us as many advantages as possible. Since humans, unlike bears, unlike other wild animals, right, we don't have claws and fangs. We're not as strong as most wild animals. So it's this fight or flight response that is part of helping us survive. Unfortunately, fight or flight can also be triggered by other stressful situations that aren't necessarily really life or death, but our system perceives them to be life or death. And so we still get the same adrenaline dump, we still get the same rush of different hormones, and all this places stress causes wear and tear on our bodies. Fight or flight is meant to be kind of a temporary thing to get us out of that situation. But it is possible for certain medical conditions, certain injuries, certain other syndromes, including mental health issues that humans have. We end up with fight or flight kind of being an ongoing thing. So we constantly have this state of high agitation that causes a lot of stress on our bodies and our systems. We're not able to return to this normal resting state, which is called homeostasis, just so you know the vocabulary term. If we're not able to return to homeostasis, then this constant wear and tear, this chronic wear and tear, can cause serious health problems of itself, again, on top of whatever the underlying issue is that created the stress in the first place. For this reason, in recent years, health psychology has begun to take an increasingly important role in healthcare. Health psychologists are becoming more and more important as part of a healthcare team, along with medical doctors, nurses, physical therapists, and others. Among the roles that health psychologists can take in the healthcare system, prevention, designing programs to help promote healthy behaviors, prevent people from getting ill in the first place. Chronic disease management. This involves helping patients manage long-term conditions like diabetes, like a cancer diagnosis that may take months, years, decades of treatment in order for someone to have a good quality of life. What's called integrative care, working in multidisciplinary teams for holistic patient care. That's kind of a mouthful. What this means is a multidisciplinary team in a healthcare setting is just a team that involves people working in the healthcare system from different backgrounds. So again, medical doctors, nurses, physical therapists, pharmacists, health psychologists, social workers, perhaps clinical psychologists. The idea is to have more than just one or two individuals, a doctor and a nurse, let's say, involved in helping someone try to make sense of, try to live with a very serious health condition. Stress reduction, another role that health psychologists now play in the healthcare system. This involves developing interventions, developing techniques, treatments for patients and healthcare providers to try and reduce stress all around the system. Obviously, the patient is central to this, but it doesn't help to have their doctors, nurses, others also be stressed because of the situation. So you kind of want everyone in the system to try and be able to operate in as relaxed a way as possible to try and maintain calm in order to let everyone remain focused. Patient communication, a big part of health psychology. Improving doctor-patient interactions, communication, making sure patients understand what their doctors are telling them, understanding what they need to do in order to take care of themselves, but also helping people on the other side, physicians, nurses, make sure they're communicating as clearly as possible. And then final example, pain management. A big challenge in recent decades has been patients that have conditions that cause pain, chronic pain, having trouble becoming addicted to narcotics because of the amount of pain medication they're taking. So health psychologists have taken a role in trying to develop non-pharmacological, that means non-drug based approaches to try and treat people with chronic pain. So again, these are just a few examples or more in the reading of the kind of work day to day that health psychologists do, part of the healthcare system. This overall concept applies to other areas of medicine as well, by the way, not just health psychology, but there's an increased understanding, belief that good healthcare involves taking into account not just whatever physical ailment or whatever specific part of someone's body is injured or suffering from disease, but also the overall connection between the mind and body. We can keep the mind healthy, happy, positive. That can also have positive outcomes in terms of someone's overall physical health. Let's review the ideas from this chapter. Again, health psychology examines how our thoughts, feelings, and behaviors affect our physical health and well-being. Health psychologists help people make better health choices, manage chronic conditions, and improve their overall quality of life. We looked at some examples of how that is done. And we also looked at examples of how health psychology has taken on an increasingly important role in healthcare, including prevention of disease in the first place and management, ongoing management of chronic diseases, including things like treatment, stress reduction, communication between the patient and his or her healthcare team. This concludes this presentation. I hope you find it helpful as you get ready to go in and read the chapter. I will see you next time in class. Good luck.